Okay, let's talk about how we pour liquids, especially when we're doing a sterile process. Because we're going to be doing trach care and trach suctioning. Maybe you're doing a wound and you're going to have to be able to pour a liquid into a sterile field. And usually using a big bottle, like you're not going to use a whole big container of a solution. So I want to go over a few of the basics. For example, this is 0.9 sodium chloride or 0.9 normal saline. It's the same thing. Notice it looks like water, but this is not sterile water. This is sterile 0.9 normal saline or sodium chloride. So we've got a 1,000 ml bottle, and we're going to take it to the patient's bedside. Now, we're not going to use this whole thing at one time. So what you need to know is whenever you use one of these and you open it, it's good for 24 hours at the bedside. And you have to date it and time it on the side of the bottle. So if I'm using it for the first time and I open it, when I open my bottle for the first time, of course the outside is not sterile. When I take the cap off, I have to set the cap up. If I set the cap down, I have contaminated my whole bottle. I cannot put it back on here and use this again because I've contaminated it. So when you open it, you take it off and set it up. And if it's the first time that you've opened it, you can pour it directly into your sterile field container. But let's say that I opened this at 7 o'clock this morning and I come in at 2 o'clock to do a procedure and say maybe to do trach care, and I'm going to have to use this solution again. I can use this, but there's something I have to do. It's called lipping. So I'm looking at it, it's date and timed, so it's within 24 hours. I will take my top off, set it with the cap up, and I always put the label in my hand because that's just something that I've learned to do passing medicines. If you happen to not put the label in your hand and you pour something, maybe it drips down on the label and it makes it to where you can't read it. So I always put the label in my hand. And before I pour it, since this has already been opened, I have to do what's called lipping it, which means I have to pour just a little bit out into a garbage can. And that essentially cleans off that area of that lip of that bottle. Now I can pour it into my sterile field and set it back down and cover it back up. Now let's say I'm going to do it. I set it down and I lip it. If I set it back down, I have to do it again because what if it doesn't clean the exact area? So you'll always pick it up, lip it, then pour it. And again, it's good for 24 hours once it's been opened, as long as you've not contaminated the inside of it. And that's it.